Well, good afternoon to everyone. We have now reached the last leg of this very interesting international conference on health literacy in Portugal, which I'm happy to say has successfully allowed us to promote a wide debate about the theme and the major trends in Portugal and in Europe. And as it had been mentioned this morning by our trustee, Dr. Isabel Mota, the promotion of health literacy is one of the major recommendations that came out from the Carlos Gulbenkian Foundation recent report on the future of for health in Portugal, and where it was stated that there needs to be a new cross-government national program in Portugal for health education and health literacy, which will equip citizens in practical terms to stay healthy and when ill share in decision-making. And in that respect, I would like to express our gratitude and special thanks to Professor Ilona Kickbusch for her invaluable expertise and input as a member of the Reports Commission and for helping us setting up this conference program. Thank you very much. As you can read in the program booklet, Professor Ilona Kickbusch is actually the director of the Global Health Program at the Graduate Institute of International and Developmental Studies in Geneva. And among many others important roles, she has worked in key areas related to global health, governance, public health, health promotion, health literacy, and health in all policies. And it is now with great pleasure that I will ask Professor Ilona Kickbusch to give us the summary and conclusions of all the brilliant contributions that we were fortunate to hear today. Professor Kickbusch, the floor is yours.
Thank you very much, and it's lovely to be back here in Portugal, and thank you to all the hardliners for staying on. So you could be out in the sun, actually. So I wanted to highlight a couple of things, some of which were said today, some of which weren't said, and therefore I want to say them, and maybe give some indications what kind of issues we might perhaps particularly focus on. Maybe it's good to sort of start from the beginning and actually ask the why question again. You know, why, as we saw from a number of these graphs in relation to policy and interest, why is it that health literacy is becoming an issue that is more interesting not only to researchers but also to policymakers? And it's of course a reflection of the fact that what we are witnessing is an increasing importance of health in our societies. We're witnessing an expansion of health into many different social arenas. And people are experiencing that more and more decisions in their everyday life are related to health. I've called that a health society. So what people experience in terms of taking these decisions is, of course, that they have to take them in relation to very different roles that they have in society. They will take these roles as parents, and we heard from one of the projects that he wants to look at that. They will take them as consumers. They will take it in relation to healthcare decisions in terms of the health system. But increasingly, and that is why also projects like on diabetes literacy, etc., are important, is that more and more people in our societies have to live with chronic disease. And these are not only older people. I think that's also very important to keep in mind. And also to keep in mind when we speak about chronic disease, we also speak about mental disorders, mental problems, and many of these are with young people. So when we say living with chronic disease, it's quite a big cross-section of our society. And these people have to take decisions every day on how to cope, how to manage, what they need to do, either for themselves, and this is the other important point, and we heard that in terms of the project of children with parents with a mental health problem. They also have to take decisions frequently in relation to their loved ones, in relation to the family. And again, very important, it's not always the parents, it can also be the children. So this is a very dynamic field, and this expansion and this need for, in quotes, good health decisions, of course, should make us then very worried if we hear that 50% of the population are not really well prepared for these tasks. I think that is extremely worrying. And that is the point we've always tried to make as we started to speak about health literacy. We're not just talking about, health education or health promotion or this, that, and the other. We're talking about an outcome. We're talking about a figure. We're talking about data and an index which shows you your society has enormous challenges. People have to cope with these challenges in their everyday life, and they are not really prepared to do so. At the same time, and the group from Bielefeld, I think, highlighted that very well, that this is happening in a society, and this is a real paradox, and we haven't yet found the answer to that paradox, in a society that, on the one hand, is full of health messages. Actually, some of us are sick of health messages. In a society that actually, and we know all the discussion about inequality, etc., and Stefan gave us a very, very good overview here, but a society that on the whole does give us a reasonable level of choice, and still people don't choose health. So the question is, what is this? Is this knowledge? Is this skills? Is this motivation? What of this construct of health literacy is really making the difference? And where then should we intervene? And again, the point about health literacy, and I still believe the most important graph we saw today is the one that Professor Pelikan had, which was developed by Ruth Parker, is to say, here's the demand of society, and here's the potential for response with the people and the individual. And health literacy is, how do those two come together? And I believe a significant amount of research actually should go into this question, and this is a social science question. Why is it that people have such low levels of health literacy in a society where this should actually not be the case? And does that reflect our education systems? Does it reflect our health systems? Does it reflect our media? Does it reflect our consumer society? What is it that leads to this enormous discrepancy? And we don't have an answer yet where that lies. And that's why a survey like the European survey really lets us, focus on that and start to ask that question. Because as important as each and every individual health literacy project is that we heard about, diabetes literacy, the children's projects, all of those things, individual policies, small and large, we mustn't, as we engage there, lose that bigger picture. It's about population health in our societies. And it's about 50% of the population who cannot respond adequately to the health challenges in their everyday life. And that means saying something. So I think also we do need to understand what Jürgen and Ruth called the demand side. What is it that exerts this, either this pressure on people that they can't act, or this temptation on people that they won't act? What is it that's actually going on in our societies? And of course, at the same time as all this is going on, and this might be one of the factors, is that health and disease in our societies are changing so incredibly rapidly. And sometimes I miss a reflection of that enormous dynamics in the literature on health literacy and some of the research. You know, the rapid change of our societies, the aging, the inequalities, the mobility, the technical and medical change that's going on. You know, if health information changes so rapidly, just think in the last year, the last 12 months, the messages we have got about health guidance that was considered sacrosanct for 25 years and more, that is no longer the case. Think of the cholesterol discussions, think of the good and bad fats discussions, you know, think of all those things. And, you know, if you're a sort of normal person, you know, what do you do with that and what do the media do with that, you know, in telling you about it? But there's, you know, sort of two types of change that are going on very, very rapidly. This health information change, the information changes, what's good, what's bad changes. Then, you know, like right now, what's really hit Twitter is a big study that says, you know, exercise doesn't actually make a difference in relation to obesity. It's what you eat. I mean, they do say, you know, move, because it means a lot for other parts of your health. But if you're obese, exercise is not going to do it, guys. You know, you've got to do something else. So, you know, it does leave people disoriented, and that might be one of the issues. But we need to understand those demands better. But also health systems change. Think how often in your own context the rules of the game have changed. You know, who pays? When can I visit my doctor? What does this cost? Is my doctor available? The emergency systems were mentioned. And health systems change, but they don't change to fit the needs of people. And, you know, it's not just because people are stupid that they go to emergency services. It's probably because their everyday life doesn't allow them to go to a doctor's office and wait there for 2 hours in, you know, whatever other challenges they have between 9 and 5. And so, you know, maybe we should be adjusting our health systems to the real lives of people. So we have all these big social changes that people have to deal with. We have all these health and health systems changes that people have to cope with. And there's another thing that people have to cope with in the context of these health systems changes, that more and more is expected of people, and more is expected of patients. And on the one hand, what is a movement for patient empowerment and co-production, as Jürgen also called it, is of course also a delegation. And what we're seeing is a delegation from the health system to the household. And this need to take decisions in the household in relation to living with chronic disease, in relation to food, again, you know, all this cooking and healthy shopping and all of that. And as we know, the relationship building that goes on. So the home is starting to become a kind of health center, including all, you know, the electronic stuff that you use at home and the monitoring that's starting. So people have to cope with enormous amounts of change. And that also means that there is probably a lack of reliability and increasing lack of readability of systems because, you know, they are constantly changing, and possibly also a lack of trust in systems. And that is something that will have to be looked at. So this readability of systems on the side of the demand side in relation to health is important, and that can be, you know, the readability of your tomato soup, so that you see how much sugar there is, or the readability of your health insurance, or whatever. So I think if we then look at health literacy, 4 things seem to me to be very important in that we need to start considering more. One is the complexity of the demand on people. It's not just one demand. And in what kind of skills do people need to deal with complexity? And that complexity is, for example, reflected in multimorbidity. So still a lot of our research then is disease by disease by disease, and a lot of our interventions are disease by disease by disease. We run a chronic disease self-management program that, consciously is not disease-focused, and we had a tremendous difficulty getting all these disease-based NGOs on board, because they want to do rheumatic, and they want to do diabetes, and they want to do cancer. And whereas at the same time, in working with the people, we saw not only that most of them had more than one chronic condition, but also, and this is important, they had both a physical and a mental chronic condition. And that interface is also something that is an increasing challenge for people, how they can cope with both. So I found it very important that the colleagues from Bielefeld highlighted mental health so much, but probably, sort of seeing in what way, and it can work in both directions, how the mental and the physical health actually interface is quite important. Another thing in relation to health literacy, and that I found very interesting, looking at the subject areas of health literacy, probably because it came out of health promotion, it's very NCD focused. With some small exceptions, there was a reference to vaccination, etc. At the same time, we are facing again major issues around infectious diseases. And one of the great challenges our societies are going to face is, for example, antimicrobial resistance. And that starts, with something as simple as, do you know how to actually wash your hands? And this, by the way, is not only for people, but also for professionals, if studies in Switzerland are anything to go by. So I think as we continue to study, particularly at a population level, the health literacy, I believe a whole number of those issues also need to be included. It was less the case in Europe, but if you also look at the extreme hysteria that developed in the United States around Ebola, for example, because people have lost an understanding of infectious disease, what you actually need to be afraid of. I think there's something important here. And of course, knowledge of vaccination, a key population health issue, where we have, 1,000 people with measles in Berlin right now, because it's not the people with low health literacy that are not having their kids vaccinated. It's very well-educated parts of our population who don't believe in vaccines. And that is a challenge for health literacy that I think a paradox that we need to deal with and possibly understand better in research because it's expanding. So 3 things in terms of implementing programs for health literacy. I said, we need to, as we develop such programs, consider complexity, multimorbidity, infectious disease, and mental health. We need to see, as people need to do in their everyday life, how do you navigate and what help do people need for navigation? And how do you make trade-offs? Because many health decisions are trade-offs with others and with yourself. And that is also something in terms of skills and motivation that is quite important. How do you manage change? And how do we deal with vulnerability? And here again, the vulnerability in context is very, very important, and many of the issues that Stefan drew to our attention today are very, very critical. That leads to my more or less final point before I come to some political consequences, and that is, for us, health literacy was always related to empowerment. When we sort of started talking about this in the 1980s in the context of the Ottawa Charter for Health Promotion. It was not about doing what your doctor says. It was about empowerment, and that also meant that you should be able to negotiate with health professionals. You should be able to make trade-offs yourself. I prefer more pain and less maybe need to sleep, or those kind of things as treatments are decided or whatever. But really, I would urge us not to lose that empowerment dimension in the whole health literacy debate. And sometimes I have a feeling it's sort of not as present as I perhaps might like to see it. How in terms of health literacy, and you rightly said, it's about citizens. It's about citizens in modern society who should be participating in their health, if health is a major part of this society. And in our societies, it is between 10 and 15% of the gross national product. I mean, that's a heck of a lot of money, and it's growing. So where do citizens have a voice, and how is that expressed in health literacy? And how do you measure the one or the other? Are there communities, even vulnerable communities, that have higher health literacy than perhaps to, better social integration? Disease in a vulnerable community, maybe you're more isolated in an, in quotes, rich community and more integrated in another one. I don't know. But those are the kind of things I believe we should also be looking at. Resilience. And that's a challenge I'd like to put to health literacy. Linked, if it is a community a category, and if it is an individual category. And that, I believe, is something we could really look at more in more detail. So my last point is in relation to some of the political consequences. Very happy to have, that policy paper, which in a way reflected. It's sort of there, but people don't really, in terms of a policy priority. So politicians really haven't quite caught on. Explain to them yet what population cannot deal with the health challenges that your society poses. And I do think we need to find a different language and maybe, a different framing, as one says in political science, to put across what is really at stake here for society and for people, for each individual. So for me, at least, health literacy, a high level of health literacy, is in part a contribution because people in relation to their health. And that also means in relation to their determinants of health, pollution in my backyard kind of. Your contribution to a fairer society, to balancing out if you either do a some of those issues. But also, in what way is health literacy a contribution for sustainable health? We want to save money in our extremely expensive health systems. But we need to save it with something, empowerment and the quality of life, much more deeply about what co-production means in relation. And that leads to my last point. Maybe strategically, it might be quite helpful. There are always, sort of times when certain concepts are in. Health literacy seems to be sort of moving. One concept that's gaining a lot of interest right now in the health arena is the notion of health in all policies. And we have heard from a number of the speakers today that we will need interventions in many different arenas of policy. We heard about schools, the workplace, we heard about consumer, we heard about. So I think maybe also thinking about how one links those agendas, how health literacy is element of health in all policies, and to go back to the beginning, obviously, if we want to work on the demand side and on the side of people's knowledge, etc., and health literacy, for both, we need the other sectors. Actually, the health sector itself does relatively little education, and therefore we need all the education. And we need new types of readable systems and learning organizations to a society where we don't have 50% of the people not being able to deal with the health challenges they face. Thank you very much, and have a good evening.
Well, we have reached the end of this conference, and I would like, in the name of the Carlos Gulbenkian Foundation and in my name, to thank all the speakers and chairs for their brilliant intervention and fundamental inputs, and especially here now Ilona for her very clear and enlightening conclusions, summary and conclusions. I'm also grateful to the public who attended this conference. A special thank to the professors Rita Espanha, Patricia Avila and Rita Veloso for their collaboration in setting up the conference, and congratulate them for their very interesting and important health literacy survey in Portugal and effective actions in the field and of public health initiatives, and to the development of a comparative perspective with other European countries. And last but not least, to thank Madalena Queiroz Melo for her excellent work and the Carlos Gulbenkian team who made this international conference possible. Thank you very much, and I wish you all a safe journey home.